Assalamu alaikum. Today's article is titled Case Report of Maxillary Alveolar Rhabdomyosarcoma Misdiagnosed as a Periapical Lesion. This case report, published in the Australian Endodontic Journal in August of 2025, described a rare case of alveolar rhabdomyosarcoma that initially presented with clinical and radiographic features resembling an endodontic periapical lesion. So a 15-year-old male presented with a swelling and pain in the right maxilla. He had previously been treated as a dental abscess at another center, but the swelling progressed rapidly over 2 weeks and extended toward the inferior palpebral region. The patient also reported intermittent epistaxis. Clinically, a rubbery swelling was found in the buccal sulcus between teeth 12 and 16, especially around teeth number 14 and 15. The area was tender on palpation, but the overlaying mucosa appeared normal. Pulp vitality testing showed non-vital responses in teeth 12 to 17, which made the lesion appear similar to an endodontic infection. Radiographically, the panoramic radiograph showed loss of the visible wall of the right maxillary sinus and root resorption related to tooth number 16. The periapical radiograph showed widening of the periodontal ligament space around tooth number 15, especially around the mesobuccal and palatal roots of tooth number 16. CBCT showed a destructive lytic lesions extending from the tooth number 14 to 18 with laminar dura loss, root resorption, thinning and destruction of the maxillary sinus walls, and extension toward the nasal septum. Because the lesion had aggressive radiographic features, the patient was referred to the ENT department. Further imaging with MRI and CT scan was performed, followed by incisional biopsy. MRI showed large soft tissue mass measuring 46 by 52 by 54 millimeters, filling the right maxillary sinus and extending into the right nasal cavity, ethmoid sinuses, subcutaneous tissue, orbital floor region, and the hard palate. Histopathologic examination showed a cellular malignant neoplasm composed of primitive round cells with hyperchromatic nuclei and scant cytoplasm. Immunohistochemical analysis was positive for myogene and dysmine with high Ki-67 proliferation index of 80 to 90%. These findings confirmed the diagnosis of alveolar rhabdomyosarcoma. The authors emphasized that rhabdomyosarcoma is the most common malignant soft tissue tumor of the head and neck region in children, with the alveolar subtype demonstrating a more aggressive behavior, poorer prognosis, and higher metastatic potential. In this case, PET findings suggested possible metastatic involvement of the cervical lymph nodes and skeletal structures. They also highlighted important signs that should raise suspicion for malignancy in lesions mimicking periapical pathology, including multiple tooth involvement with periodontal ligament widening beyond the apical region, moth-eaten bone destruction with cortical perforation on the CBCT, and associated symptoms such as epistaxis and periorbital swelling. So in conclusion, dentists should not assume all periapical radiolucencies are endodontic in origin, and that atypical features should prompt advanced imaging, biopsies, and referrals, as early diagnosis may be life-saving. Thank you.